The Access in Medicine program invites you to learn about service animals in clinical and lab environments. This video was created utilizing information from Chapter 5 of the book Equal Access for Students with Disabilities, the Guide for Health Science and Professional Education. This valuable resource is now free to access using the QR code visible on the screen or by navigating online to docswithdisabilities.org. We thank the authors Lisa M. Meeks, Jan Sarantino, Nira R. Jane, Elisa P. Laird, Alicia Booth, Grace C. Clifford, Charlotte O'Connor, and Jane Thierfeld Brown for permission to use their important work. Under the ADA, a service animal is a dog of any breed or size that has been individually trained to perform specific tasks for a person with a disability. These tasks can take many forms. A service animal might guide someone who is blind, alert someone who is deaf, respond to a seizure, remind someone to take medication, or help manage disability-related symptoms during an anxiety attack. The key is that the animal is trained to perform a specific task directly related to the person's disability. It's also important to distinguish service animals from emotional support animals. A dog whose only role is to provide comfort or emotional support is not considered a service animal under the ADA, although emotional support animals may have protections under other laws, such as the Fair Housing Act. Finally, some state and local laws provide broader protections, so institutional policies should account for applicable state and local requirements as well as the ADA. There are several common misconceptions about service animals. First, service animals are not required to be certified or to complete a professional training program. The ADA does not require or recognize certification as proof that a dog is a service animal. Second, service animals are not required to wear a vest, harness, or other identifying gear. Many handlers choose to use these items, but they are not legally required. Third, an institution cannot require a person to register their service animal as a condition of access under the ADA. Service animals can, however, be subject to the same licensing and vaccination requirements that apply to all dogs. Finally, emotional support or comfort animals are not service animals under the ADA when their sole function is providing comfort. A service animal is individually trained to perform specific work or tasks related to a person's disability. One important distinction is that the use of a service animal is not an accommodation that requires the traditional interactive process. A student does not need to request an accommodation or receive permission from the institution to be accompanied by their service animal in areas where members of the public are permitted to go. This is different from many other disability-related accommodations, which typically involve a request, an interactive process, and an individualized determination. For service animals, the starting point is access. There may be limited circumstances in which a service animal can be excluded from a particular setting, which we'll discuss next, but the student does not first have to obtain institutional approval simply to use a service animal. Here are a few important considerations when working with a student who uses a service animal. The starting point should be a presumption of access. A student who uses a service animal should generally be permitted to bring the animal into educational environments, including many clinical and laboratory settings. Under the ADA, individuals with disabilities have the right to be accompanied by their service animals in most areas where they are otherwise permitted to go. One helpful way to think about this is to consider a service animal alongside other disability-related aids, such as a wheelchair or cane. The service animal is not a pet or a privilege. It performs disability-related work or tasks that enable the student to access and participate in the environment. This framing shifts the question from, should we allow the service animal? To, is there a specific, legally recognized reason the service animal cannot be in this particular setting? In most environments, access should be the starting point. There are very limited circumstances in which access for a service animal may be restricted. Under the ADA, one of those circumstances is when the animal poses a direct threat to the health or safety of others. Importantly, a direct threat means a significant risk, not simply a concern, fear, or inconvenience. The determination must be based on an individualized assessment of the specific animal and the particular circumstances, using objective evidence about the actual risk. It cannot be based on assumptions, stereotypes, generalizations, or the animal's breed. In other words, the question is not, could a service animal create a problem here? The question is, does this particular animal in this particular situation pose a significant risk to health or safety? And even when a risk is identified, the analysis does not necessarily end there. If reasonable modifications can sufficiently reduce or eliminate that risk, access should be maintained. The key is to begin with access and address any safety concerns through an individualized, evidence-based assessment, not through hypothetical concerns about what might happen. The CDC also provides specific guidance on service animals in healthcare settings. Importantly, the CDC notes that there is no evidence suggesting that service animals pose a greater risk of transmitting infection than people. For that reason, generalized infection control concerns alone are not a basis for routinely restricting service animal access. If a specific infection control concern does arise, decisions should be based on the actual circumstances and an individualized assessment of risk, not assumptions about the presence of an animal in a healthcare environment. Again, the starting point is access. The CDC provides a practical framework for applying this guidance in healthcare settings. If healthcare personnel, patients, and visitors are permitted to enter an area without additional infection control precautions, such as gowns, gloves, or masks, a clean, healthy, and well-behaved service animal should generally be permitted to accompany its handler as well. This can include inpatient rooms, some ICUs, public areas, and other patient care areas where additional precautions are not required. The key is to assess the infection control requirements of the specific environment rather than assuming that the presence of a service animal creates an infection risk. If a specific concern does arise, the assessment should focus on the actual circumstances and whether that risk can be addressed through reasonable measures. Infection control decisions should be based on actual risk and applied consistently, not simply on the fact that an animal is present. When additional precautions are necessary, the next question is how we can address the identified risk while maintaining access whenever possible. If a specific infection control concern does arise, the next step should not automatically be to exclude the service animal. Instead, identify the actual risk and consider whether reasonable measures can reduce or eliminate it while maintaining the student's access. Depending on the environment, this might involve adjusting where the service animal is positioned, modifying workflow, maintaining appropriate separation from a sterile field, using barriers, or considering protective equipment when appropriate. The goal is to determine whether the identified risk can be effectively managed. Restricting access should be considered only when there is a specific risk that cannot be sufficiently mitigated. A common concern is whether a service animal should be permitted in the room of an immunocompromised patient. The CDC provides helpful guidance here as well. If the patient is able to receive visitors without additional protective garments or equipment, a clean, healthy, and well-behaved service animal should generally be permitted to enter with its handler. In other words, immunocompromised status alone does not justify restricting a service animal. The assessment should be based on the infection control precautions required for that particular patient and the actual risk in that situation. Again, We assess the specific circumstances rather than making assumptions based on the presence of a service animal. In March 2026, the CDC issued an important clarification regarding service animals in laboratories. This followed confusion about language in the sixth edition of the Biosafety in Microbiological and Biomedical Laboratories, or BMBL, stating that animals not associated with the work being performed are not permitted in laboratories. Some institutions interpreted this as a blanket prohibition on service animals. The CDC clarified that this was not the intent. The BMBL provides biosafety guidance and does not supersede federal, state, or local disability laws. Instead of automatically excluding service animals from laboratories, institutions should conduct an individualized risk assessment. This means considering the hazards in the particular laboratory, the work being performed, the specific circumstances, and whether identified risks can be mitigated. The important takeaway is that biosafety and accessibility should be considered together, not as competing priorities. There is an important distinction in the CDC clarification that is worth emphasizing. The CDC states that the BMBL cannot be used to deny reasonable accommodations required under disability law. At the same time, as we discussed earlier, simply being accompanied by a service animal generally does not require a student to request an accommodation or obtain prior approval. These are related but distinct concepts. Service animal access is generally the starting point. However, in a laboratory environment, there may be circumstances in which additional modifications are needed to address a specific hazard while maintaining the student's access. Those modifications may involve an accommodation process. The important point is that the BMBL provides biosafety guidance. It does not supersede disability law, and its language about animals in laboratories cannot be treated as a blanket prohibition that ends the analysis. Instead, institutions need to consider both obligations together. Identify the actual laboratory hazards, determine how those risks can be mitigated, and provide access consistent with applicable disability law. So, bringing all of this together, service animals should generally be permitted in areas open to the public, throughout most campus environments in many laboratory settings, and throughout most healthcare environments, including patient rooms. There may be particular circumstances where an individualized assessment identifies a legitimate safety or infection control concern. But those decisions should be based on actual risk and whether that risk can be mitigated. This also has an important implication for institutional policy. Rather than creating lists of places where service animals are prohibited, policies should describe the limited circumstances that may require access to be restricted and provide a process for individualized assessment. The overarching approach is simple. Start with access, assess actual risk, mitigate when possible, and restrict only when necessary. This video is a product of the Docs with Disabilities Initiative's Access in Medicine program in partnership with the University of Michigan Center for Disability Health and Wellness. The contents of this video were developed under a grant from the National Institute on Disability, Independent Living, and Rehabilitation Research. NIDLR Grant Number 90RTHF0005. NIDLR is a center within the Administration for Community Living, Department of Health and Human Services. The contents of this video do not necessarily represent the policy of NIDLR, Administration for Community Living, or Health and Human Services, and you should not assume endorsement by the federal government. This video is a product of the Docs with Disabilities Initiative and their Access in Medicine program. For additional resources and information about the Docs with Disabilities Initiative, please visit the Docs with Disabilities Initiative website or follow us on YouTube, Twitter, Instagram, and LinkedIn.